Aging is a natural law that no one can avoid. Over time, people will gradually enter a new stage of life, old age, with obvious changes in both physical and mental health. No longer as healthy as when they were young, the elderly often face fatigue, difficulty walking, poor sleep and eating, memory loss, and are susceptible to many chronic diseases. These changes make many people wonder, why do people get weaker as they get older? This is not only a question about health, but also a deep concern for the quality of life of themselves and their loved ones when they get old. In fact, the weakening of the body over time is not a random phenomenon, but the result of the natural aging process, occurring in every cell and organ in the body. Understanding the causes of aging not only helps us better understand the biological laws of humans, but also opens up important directions in maintaining health, prolonging life, and living happily and healthily in old age. 1. Decline in cell and organ function. The human body is a complex system made up of billions of different cells. These cells undertake many important life functions, from metabolism, protein synthesis, signal transmission to the formation of tissues and organs. However, over time and the natural aging process, these cells gradually become damaged, weakened, and no longer have the ability to regenerate as effectively as before. This is the main cause of decline in the function of organs in the body. Cell aging. When young, the cells in the body are active, have the ability to divide and recover quickly. But with age, the accumulation of harmful factors such as free radicals, environmental toxins, chronic inflammation, and DNA damage gradually weakens the cells. Aged cells often lose the ability to divide or function less effectively. Some cells will enter a state called cellular senescence, which means they still exist but no longer have normal physiological function. Impact on important organs. Poor cell function directly affects the performance of organs. Cardiovascular. Damaged or degenerated heart muscle cells reduce the ability to contract and circulate blood, leading to problems such as high blood pressure, heart failure, or myocardial infarction. Liver. The liver gradually loses the ability to detoxify, metabolize substances, and synthesize proteins due to damaged liver cells. This can cause toxins to accumulate in the body and reduce anti-inflammatory and digestive abilities. Kidney. The kidney's blood filtering and excretory functions are impaired, increasing the risk of diseases such as chronic kidney failure, high blood pressure, and electrolyte disorders. Brain. Degenerative nerve cells reduce the ability to remember, think, and control behavior. This is the cause of neurological diseases commonly found in the elderly, such as Alzheimer's or Parkinson's. Consequences for overall health. The decline in cell and organ function makes the body less flexible, has weaker resistance, and is susceptible to infectious diseases and chronic diseases. The recovery process after injury also becomes slow. The elderly often have difficulty adapting to changes in the environment, diet, or medical treatment. Solutions to slow down the decline in function. Although it is impossible to completely prevent the aging process, people can slow down the decline in cell and organ function through proper nutrition, providing adequate vitamins, minerals, and antioxidants to help protect cells from damage. Regular exercise helps improve circulation, strengthen heart and lung function, and keep muscles toned. Quality sleep helps cells recover and regenerate more effectively. Stress control. Prolonged stress increases free radicals and damages cells. Regular health checkups. Early detection of signs of deterioration for timely intervention. Conclusion. Deterioration of cell and organ function is an inevitable part of the aging process. However, through a healthy lifestyle and proper care, people can slow down this process, maintain health, and improve quality of life. Understanding the mechanism of cell deterioration not only helps us have a correct view of aging, but also promotes awareness of protecting and caring for the body from a young age. 2. decreased muscle mass and bone density in the elderly. Overview of aging. Aging involves many physiological changes in the human body, of which the two most obvious and common manifestations are decreased muscle mass, sarcopenia, and decreased bone density, osteoporosis. These changes not only affect mobility, but also increase the risk of falls, fractures, loss of independence in daily activities, and reduced quality of life. Decreased muscle mass, sarcopenia. Concept and causes. Sarcopenia is a condition of gradual loss of muscle mass and muscle strength, usually starting after age 40 and becoming more obvious after age 60. Causes include natural aging, the process of muscle cell degeneration due to age, reduced physical activity. Lack of exercise reduces stimulation for muscle growth. Poor nutrition, lack of protein, vitamin D, and important micronutrients. Hormone decline. Testosterone and growth hormone, GH, decrease with age. Chronic diseases, diabetes, arthritis, cardiovascular disease, etc. Consequences of muscle loss. Weakened strength and endurance. Reduced ability to perform daily activities such as walking, standing, carrying. Loss of balance, easy to fall. Increased risk of bedridden, loss of self-care ability. Decreased bone density. Osteoporosis. Concept and causes. Osteoporosis is a condition in which bone mineral density decreases, making bones brittle, porous, and prone to fracture. This is a common phenomenon in the elderly, especially post-menopausal women. The main causes include decreased hormones. Estrogen in women and testosterone in men decrease with age. Calcium and vitamin D deficiency, due to inadequate diet or poor absorption. Lack of sunlight exposure reduces vitamin D synthesis. Lack of physical activity causes bone mineral loss. Long-term use of medications, such as corticosteroids, anti-epileptic drugs. Consequences of osteoporosis. Increased risk of fractures, especially in the hip, wrist, and spine. Causes prolonged pain and spinal deformity, kyphosis. Loss of mobility and independence. Increased risk of death from complications after fracture. The link between muscle loss and osteoporosis. These two conditions often occur together and aggravate each other. Weak muscles reduce the ability to protect and support bones during falls. Weak bones increase the risk of fractures with minor impacts. Reduced physical activity due to muscle loss leads to decreased bone density. Prevention and improvement measures. Regular physical activity. Resistance training, using light weights, elastic bands increase muscle and bone density. Walking, aerobics, yoga, tai chi helps improve balance, coordination, prevent falls. Note to exercise in accordance with health status, with guidance from experts. Adequate nutrition. Increase protein. Lean meat, fish, eggs, tofu, milk. Supplement calcium and vitamin D from food, milk, green leafy vegetables, or supplements. Divide meals into small portions. Helps absorb better in the elderly. Avoid excessive alcohol, tobacco, and caffeine, factors that weaken bones. Regular health checkups. Measure bone density, DEXA scan, to detect osteoporosis early. Assess muscle mass with tools such as BIA or MRI. Monitor hormones, liver and kidney function, nutritional status. Use medications and supplements if necessary, as directed by your doctor in cases where osteoporosis or sarcopenia has been diagnosed. Some medications can help slow bone loss, increase calcium absorption, and increase natural growth hormones. Conclusion: reduced muscle mass and bone density are two major challenges for the elderly, directly affecting mobility and quality of life. However, with the right awareness, a reasonable lifestyle, adequate nutrition, and regular exercise, the elderly can completely minimize the risk and maintain an active, healthy, and independent life. 3. Cardiovascular and respiratory impairment in the elderly. Aging is a natural stage in life, accompanied by many physical and functional changes in the body's organs. Among them, the cardiovascular and respiratory systems are the two organ systems most clearly affected by the aging process. These changes may not cause obvious symptoms initially, but in the long term, they will reduce the quality of life and overall health of the elderly. Understanding these effects helps the elderly to be more proactive in health care and disease prevention. Cardiovascular impairment in the elderly. Changes in the structure and function of the heart. As age increases, the heart, the machine that pumps blood in the body, is also affected. The heart muscle thickens and becomes stiffer, reducing the heart's ability to contract and relax. The heart valves become fibrotic and calcified, affecting the blood flow in the heart. Heart rate slows down and may become irregular due to deterioration of the electrical conduction system in the heart. Blood vessels lose elasticity. Blood vessels, especially arteries, gradually lose their natural elasticity, making blood pressure more likely to increase. Atherosclerosis is also more common, narrowing the lumen and reducing blood flow to organs such as the brain, kidneys, muscles, etc. Consequences. Reduced blood flow to organs leads to fatigue, dizziness, lightheadedness, memory loss. Increased risk of cardiovascular diseases such as high blood pressure, heart failure, arrhythmia, coronary artery disease. Respiratory system decline in the elderly. Decreased lung function. The vital capacity of the lungs decreases due to the loss of elasticity of lung tissue. The respiratory muscles, especially the diaphragm, become weaker, reducing the effectiveness of deep breathing. The chest becomes stiffer, no longer expanding as easily as before. Reduced gas exchange capacity. The reduction in the surface area of gas exchange in the alveoli reduces the ability to supply oxygen and remove CO2. Elderly people are prone to feeling short of breath, especially when exerting or exercising. Increased risk of respiratory diseases. Susceptible to diseases such as chronic bronchitis, COPD, pneumonia. Reduced ability to cough up phlegm increases the risk of phlegm retention and respiratory infections. Overall impact on health. The decline of both the cardiovascular and respiratory systems causes the elderly to reduced endurance and overall physical strength, easily tired, dizzy, short of breath when doing light physical activities such as walking, climbing stairs, difficulty in daily activities, increased risk of falling and dependence on others. Preventive and improvement measures. Healthy lifestyle, regular exercise, suitable sports such as walking, yoga, swimming, qigong helps strengthen heart and lung function. Reasonable diet. Increase green vegetables, fiber, limit saturated fat and salt. Get enough sleep, control stress. Regular health checkups. Measure blood pressure, check electrocardiogram, ECG, echocardiogram to detect cardiovascular disease early. Respiratory function tests. Regular chest x-rays to evaluate the lungs. Avoid risk factors. Do not smoke. Avoid exposure to dust, air pollution. Control underlying diseases such as high blood pressure, diabetes, dyslipidemia. Conclusion: cardiovascular and respiratory system decline is an inevitable part of the aging process. However, if seniors are fully equipped with knowledge, maintain a healthy lifestyle, and have regular health checkups, it is completely possible to slow down this decline. Protecting heart and lung function not only helps prolong life, but also brings a more active, healthy, and independent life in old age. 4. The immune system weakens with age. Understand it correctly to better care for the health of the elderly. When entering middle age and old age, the human body undergoes many physiological changes, including a marked decline in the immune system. This makes the elderly susceptible to infections, slower recovery after illness, and less effective response to vaccines. Understanding the decline in immunity in the elderly is an important first step to protecting and improving health during this stage of life. What is the immune system and how does it work? The immune system is a complex network of cells, tissues, and organs that helps protect the body from harmful agents such as bacteria, viruses, fungi, and parasites. The main components of the immune system include white blood cells, the main cells in detecting and destroying pathogens. Lymphatic system helps transport immune cells to where they are needed. Antibodies, proteins that recognize and neutralize pathogens. Immune organs, bone marrow, thymus, spleen, and lymph nodes. When the immune system is working effectively, the body can fight off infectious diseases, recover quickly from illness, and respond well to vaccinations. Why does the immune system weaken with age? As we age, the natural aging process causes the body's functions to decline, including the immune system. Some of the main causes include immune cell decline. The production of new white blood cells slows down. T cells, an important type of immune cell, decrease in number and effectiveness. The ability to recognize and destroy bacteria and viruses is weakened. Antibody dysfunction. The elderly body produces fewer antibodies. The ability to remember immunity, secondary immune response decreases. Chronic inflammation, inflammaging. In the elderly, the body is often in a state of prolonged mild inflammation, affecting immune function. Consequences of a weakened immune system in the elderly. Vulnerable to infectious diseases. Elderly people are often susceptible to flu, pneumonia, bronchitis, urinary tract infections, skin infections, etc. These diseases not only occur frequently, but can also be more severe than in young people. Slow recovery after illness. Due to poor cell regeneration and immunity, the recovery time of the elderly is often prolonged, and they are prone to complications or recurrence. Reduced vaccination effectiveness. Vaccines such as flu, pneumonia, shingles, etc. are still effective, but their protective effectiveness is reduced compared to that of young people. This puts the elderly at risk of disease, even after vaccination. How to strengthen immunity in the elderly. Although it is impossible to completely prevent the aging process, there are many ways to help the elderly strengthen their immune system. Proper nutrition. Supplement with adequate vitamins and minerals, especially vitamin C, D, E, zinc, selenium. Eat lots of green vegetables, fruits, whole grains, protein-rich foods. Drink enough water every day. Regular physical activity. Gentle exercise such as walking, yoga, etc. helps blood circulation and increases resistance. Get enough sleep. Sleeping deeply and sufficiently for 6 to 8 hours each night helps the body recover and regulate the immune system. Get full vaccinations. Getting annual flu shots, pneumococcal vaccines, shingles, COVID-19 vaccines, etc. is an effective way to reduce the risk of disease. Stay optimistic. Avoid prolonged stress and anxiety, because stress also negatively affects the immune system. Conclusion: a weakened immune system is a natural part of aging, but it doesn't mean we can't control it. By understanding the changes in the body and applying appropriate care measures, seniors can still live healthy, active lives and prevent many dangerous diseases. Let's care for and support seniors in maintaining comprehensive health, starting with protecting the immune system. 5. Memory and cognitive decline in the elderly. A major concern for mental health and quality of life. Old age is a natural stage of life in which the body and brain undergo certain changes. One of the common and worrying manifestations in the elderly is memory and cognitive decline. This is not only a phenomenon of normal aging, but can also be an early warning sign of serious diseases such as dementia or Alzheimer's. This condition significantly affects the quality of life, daily living ability, and independence of the elderly. Therefore, Understanding the causes, signs, and prevention methods is essential to maintain brain health in the elderly. Causes of memory and cognitive decline in the elderly. Memory and cognitive decline can be caused by many factors, including natural aging of the brain. As age increases, nerve cells function less effectively. The process of transmitting nerve signals slows down. Cerebral anemia, poor circulation, causes the brain to not receive enough oxygen and nutrients. Underlying diseases. Diseases such as diabetes, high blood pressure, high blood fat, stroke, all affect brain function. Nutrient deficiencies, especially vitamin B12, omega-3, iron, folic acid. Stress, depression, insomnia. Prolonged negative psychology causes damage to the brain. Use of drugs or stimulants. Some drugs can affect memory if used for a long time. Signs of memory and cognitive decline. Elderly people need to pay special attention to the following symptoms: often forgetting the names of relatives, familiar objects, forgetting appointments or recent work, difficulty concentrating, easily disoriented when in a strange place, difficulty using words or expressing thoughts, difficulty performing familiar daily tasks, signs of emotional changes, irritability, anxiety or withdrawal, reluctance to communicate, repeating a question or action, losing the ability to plan, organize work, and make simple calculations. When symptoms become severe and prolonged, it may be a sign of dementia or Alzheimer's disease, requiring early specialist examination. Affects quality of life. Memory loss not only affects the individual patient, but also puts great pressure on the family and society. Elderly people can become dependent on caregivers, lose independence, prone to accidents, get lost, forget to take medication, lost social connection due to fear of communication, at risk of depression, anxiety. Prevention and improvement of memory loss. Prevention and support for improving memory should be started as early as possible, especially after the age of 60. Some effective measures include a reasonable diet. Eat lots of green vegetables, fish, nuts, fruits rich in antioxidants. Supplement omega-3, B vitamins, B6, B9, B12, vitamin E, D. Drink enough water every day. Enhance brain activity. Read books, learn new things, play chess, do crossword puzzles, Sudoku. Communicate regularly with friends and family. Exercise regularly. Walking, yoga, qigong, tai chi. Help increase blood circulation to the brain. Help improve mood. Reduce stress. Get enough sleep. Elderly people need to sleep 6 to 8 hours a day. Limit the use of electronic devices before going to bed. Control underlying diseases and psychology. Get regular health checkups. Control blood pressure, blood sugar. Avoid stress. Maintain an optimistic spirit. When to see a doctor. If the elderly have signs of increasingly severe memory loss, loss of self-care ability, unusual behavioral changes, they need to be taken to a neurologist or geriatrician for timely diagnosis and treatment. Some imaging tests, MRI, CT, or cognitive assessment tests may be necessary. Conclusion: memory and cognitive decline in the elderly is a common problem, but cannot be ignored. Understanding, early detection, and having a reasonable care strategy will help the elderly maintain a more active, independent, and happier life in their old age. Memory care. Protecting a healthy and complete old age. The weakening of the body with age is an inevitable phenomenon in the natural development cycle of humans. From the decline in cell function, muscle and bone loss, to the less effective functioning of the immune system, cardiovascular system, and brain. All are manifestations of the comprehensive aging process. Although it is impossible to completely prevent this process, understanding the causes and mechanisms of age-related weakening plays an extremely important role in helping each person prepare mentally, adjust their lifestyle, and take care of their health in a more proactive and scientific way. The good news is that today, with the advancement of medicine, nutritional knowledge, as well as the community's increasing awareness of healthy living, old age is no longer synonymous with dependence or comprehensive weakness. An elderly person can absolutely maintain an active life, a clear mind and stable health if they know how to eat properly, exercise regularly, maintain a positive mood, and have regular health checkups. In short, getting old does not mean losing vitality, but is a new journey that requires us to listen, understand, and appreciate our bodies more. When we understand why people get weaker as they age, we not only learn to accept the laws of nature, but also know how to proactively maintain our health, live happily, live healthily, and live meaningfully at any age.